Thank you very much for the invitation to participate. It's been great to be included in the WCM EADO conference. I was very glad to provide an update on the mature follow-up from CheckMate 67, which was the 3-arm randomized trial in patients with first-line metastatic melanoma who received either Ipilimumab to block CTLA-4, Nivolumab to block PD-1, or the combination. And now with 5+ years of follow-up, we see a sustained improvement in survival for both of the PD-1 or Nivolumab-containing groups over the patients who were initially randomized to Ipilimumab alone. There's a modest difference between Nivolumab and Nivolumab plus Ipilimumab, about an 8% improvement in survival at the 5-year landmark. We're expecting further data with a 6.5-year follow-up to be presented later this year. A major question in the field is whether some patients might be identified in advance who could receive only Nivolumab versus those who receive the combination, given the significant increase in the number of toxicities in the patients who receive the combination compared with Nivolumab alone. Right now, we don't have a real biomarker-driven way to make that analysis, but I think that we all use standard sort of clinical determinants. However, there are also various clinical trials going on, including one led by my colleague, Michael Postow, looking at adaptive dosing of the combination therapy, where patients receive 2 doses of the combination, and then if they have what's been termed a favorable anti-tumor effect at week 6 imaging, they are then crossed over to single-agent Nivolumab. And so we're waiting for longer-term follow-up of strategies like that, which literally adapt the dosing of the combination to individual patients based upon their response. So trying to get out of a one-size-fits-all kind of treatment approach. While we're talking about combinations, it's important to remember that there are other combinations being explored. We heard a recent press release that the combination of Nivolumab plus an anti-LAG-3 antibody, Relatlimab, satisfied its primary endpoint of an improvement in progression-free survival. We don't have more information than that yet, but so there are other opportunities for combining PD-1 blockade with other immune modulators as perhaps additional areas to explore in the future.